covered entities don't support program reform. I mean, I just want to flag again the 340C proposal. But anyway, please.
Yes. I think there are some entities out there that don't support reform. I think there are some entities that do very well under the status quo, and I think are nervous that if Congress really takes on reform, that they're going to lose. I don't think that that is as true for community health centers. It's certainly not true for advocates for community health. I think because we are so eager to have a structured way to report and explain how we use our 340B savings, but I think there might be some entities that maybe aren't as eager for that transparency and are maybe concerned that some parts of the program might be clawed back because there's, these are like really influential members of the DC policy world. They're hospitals, like huge hospitals, which have a big lobby, the pharmaceutical manufacturing lobby, which I think is the biggest in healthcare, maybe the insurers, and then health centers. So I think there's sort of advantages to status quo in some of those entity types, especially hospitals. And the pharmaceutical industry hasn't really been incredibly open to compromise in terms of what a reform package would look like. So I think for Congress, they're kind of stuck in the middle of, I'm going to make someone mad, so why would I take this on at all? But I think what my view is what's going to change is that the pharmaceutical companies are going to keep pushing in the private market. Like we already see that, right? Like they're trying to do the rebate model. They did the contract pharmacy restrictions where they said you can only use one contract pharmacy at a time. And so I think as they successfully erode the program in the private market, I think there will become a tipping point where entities say it's actually, the status quo is not good enough anymore. And congressional reform might actually, help us in the long term. But I would love ACH's view to be more commonly held, that we do want to have a conversation about reform. And this is such an important program that so few people have been willing to really understand. And so I'm sure ACH will continue to play a leadership role in that.
We will. I mean, I think, and I want to be careful, so it's a couple things. So the 340C proposal obviously is really important because I think it gets at what you're speaking to, but it also strikes this really wonderful balance of it's an opt-in.
Yep.
It's attached to the existing program. It gets at the accountability and the transparency that many in the space want to see, but it also creates the protections and the guardrails for the entities who choose to step into that space.
Yeah.
And to your point, like the beauty of 340C is that you don't have to do anything. You can stay in the space of the status quo and continue to exist in that way. Or you can step into that accountability and transparency in exchange for the supports and the guardrails. And so it doesn't need to be 340C. I think there are components of 340C that we already have seen in Sustain and sort of other efforts around 340B reform. And that's the point. You know, it isn't, ACH is going to continue to lead. And I think there's 100% commitment to that and to reform. I mean, honestly, I think that's a really important piece to pull out here is that there is support for reform. It's just that the reform needs to be done in a way that is not harmful to health centers, especially in their ability to continue to create access to care and provide the services that they would otherwise not be able to provide. And I think something that you said, which I know is a little tricky, but I do want to pull it out again, is that the 340B program, there's no cost to taxpayers. There is no cost to taxpayers. So that is something, and it's complex, but it is something that comes up that I want to just lean into to have folks understand, like, no, this is not adding to your bill at the end of the day. There is no backlash for folks at home in that particular way. It actually is only a benefit, especially through the lens of health centers.